I want to get into like a few technical things about fertility.
Absolutely.
So really quick, we've kind of just answered one question. I get a lot of questions on like, what can I eat for like fertility? Is there a supplement? I think we've kind of covered the healthier your body is, the better your fertility will be. So there's no like magic fruit that's going to make you more fertile. It's just keeping your body healthy overall.
So absolutely, but there's a couple of things that you can do. For anyone that's going to be starting the journey of becoming pregnant, or I actually tell all of my females who are in their reproductive age, even if they're not about to be pregnant, a good solid prenatal vitamin, and I'm not talking about a gummy that has a lot of sugar in it.
I hate gummies. They don't get their bioavailability isn't
so we
good.
now have one major thing in common. I hate gummies as well.
They're the worst.
They're the worst. And I don't even like gummy bears, but that's maybe because
Yeah.
I just don't like that. But so a good solid prenatal vitamin that's vegan, that is vegetarian based, without a lot of artificial anything in it, that's easily digestible. I give my patients ones that are smaller. They're 3 smaller ones rather than 1 gigantic horse pill, because I didn't realize that is one of the most important things for my patients, is they can't swallow a huge pill. So being on a prenatal vitamin, I think an omega-3, a DHA omega-3 is also important. Someone just commented folic acid. The prenatal vitamins all have folic acid in them to the amount that they should. The omega-3
Is
DHA,
it 1 milligram?
It's 1 milligram, right. 1 milligram is recommended. Some have higher doses in them these days. Some people choose to take a methylated folic acid, which is methylfolate, because it gets well absorbed a little bit better. But I also put anyone who's going to be pregnant soon also on an omega-3 DHA. I've stopped giving the fish-based ones because there's mercury in them. So I give plant-based DHAs they come in different doses. I don't think it makes that big of a difference. It helps the well-being of the brain development of your fetus, and it also has benefits for you. For women that are older or are trying to preserve their fertility or have a low egg reserve, I always add coenzyme Q10, which is also called CoQ10.
Mm-hmm.
The purest form of CoQ10, which is called ubiquinol, is the form that's absorbed well by the body. For female eggs and egg well-being, 200 milligrams 3 times a day. So for a total of 600 milligrams a day of ubiquinol is the best, most recommendation for CoQ10. So again, it's CoQ10, the purest form, which is called ubiquinol, 600 milligrams total a day is basically the recommendation for anyone trying to hold on to their fertility. And that's basically what I recommend.
We're gonna make a cheat sheet of this for everyone who's listening and wants all of it. We're definitely gonna post like the exact dose, like what kind to get. So if people don't,
Thank you for being well organized. I wasn't a lot of that, but
no, this is very valuable for people.
I give forms to all of my patients that do it, and just to jump forward for a second, whenever I do a consultation with someone, I always go through all of these, and we have a pre-written form that I actually sent to my favorite pharmacy that I believe has the best brand of these medications.
Mm-hmm.
The other final supplement that you need to talk to a physician before just jumping on is called DHEA. It's the precursor for estrogen. It helps the body have an environment with a good amount of estrogen on it, and that gives a great environment for people who are trying to preserve and make their eggs, the fewer eggs they have, do really well and thrive when they're trying to use them. So that's called DHEA, and we usually give 25 milligrams of that 3 times a day for a total of 75. And again, like Dr. Mona said, we're going to put that all out there.
We are definitely, I'm going to put it on my blog too. Like it's going to be like Dr. Ghadir's cheat sheet for staying fertile. But do you mind if we go like 5 minutes over on this?
I don't mind. I have the whole hour, by the way.
Okay, awesome. I want to know for women who like, what is the age they should start like being concerned? Because for example, like we all saw you on Shaws of Sunset and you helped MJ freeze her eggs, and I don't even know what age she was at that point, but like what age are you like you're waiting too long? Like can someone who's 40 freeze her eggs? Can someone who's 38 freeze her eggs? And do you recommend, like, how do you know if they're good? Like, what do you think about that?
The earlier, the better. I tell everyone the earlier, the better. MJ and I went back and forth forever. As many people may know, MJ and I went to high school together.
Right, I love that.
And all of our friends were freezing their eggs in their mid-30s. That's when pretty much egg freezing came out, when my generation was in their later 30s.
That's when it first came out?
Yeah, because
Oh, so it's a newer
I'm
thing. I didn't
48
know.
years old right now, and egg freezing in clinical environments started about maybe 10, 11 years ago.
Wow,
It wasn't
okay.
that great, but it was still good. And nowadays, I tell everyone, if you have turned 30 years old and you do not have any significant plans of being pregnant very soon, but you do want to have a child, think about freezing your eggs.
My OBGYN, do you know Dr. Aliyabadi Thais?
Yes, absolutely. Yeah.
She's like a dear friend and my doctor, but she was like, any patient who turns 30, like immediately, that's her thing too.
When you hit 30 and it hasn't happened and you need to do an assessment and you need to think about it. I have so many people that walk into my door, they're 39 and a half years old and said, you know what, I thought I never wanted to have a child. I thought it's wrong for me and it wasn't for me. And I've completely changed my mind now. And I think that is huge because it's a backup plan. I think it's a really smart thing to do when you are 30 years old. I have had patients do it in their 20s as well. So I think that's amazing.
To be honest, like if you can absolutely afford it and you can do it when you're like 28, like it's like an insurance policy. Like I know it seems intense to someone listening, like, okay, that's super extra, but at the same time, it's like, it's basically insurance. Now, do you offer like payment plans for people? Because it is very expensive.
We do. So our clinic has worked very closely with a couple different financial institutions. Depending on your credit, we can get it as low as $181 a month. For some people, we got it at $165 a month. I mean, the total cost is about $8,000, but if someone, and many women at the age of 30 who are just beginning their careers, $8,000 is a lot of money right then and there.
Absolutely. And just so you guys know, it's not just the doctor fee. That includes the prescriptions too, or no? Is that just the doctor fee? That's just the doctor fee.
Completely separate.
The medications are expensive, so it ends up coming to like what, 10 or 11,000 probably?
It depends. So if you are very fertile, the medications are, you don't need that many. If you are not very fertile, you're going to need a lot more medications than the average person. So that's going to add up to become a little bit more expensive. The least expensive you can do the medications is going to be a few $1,000s.
Yeah.
And unfortunately, it's very complicated. It's hard to get these medications. They give us very few samples. I may be putting together some special giveaway prize very soon about medications. We've not been as busy this month, so we have some medications sitting there and we want to do something really special with them. So I want to try to do that. The medications are expensive, but you can look about financing it something between around $160 to $180 a month, and we're able to help with that. But I think this is something that's beyond important for your future and your well-being as a parent. And we also recommend this for men too, to freeze their sperm, because a lot of data has come out that says that sperm quality goes down significantly after the age of 40 as well.
I've actually just been like learning about that recently too, because I mean, with men, obviously some men have babies with women when they're like 60, but like it doesn't mean that the risk is going, the risk is getting there as you get older.
100%.
Some women are asking.
And by the way, the other end of how if it's too old. So MJ was really lucky. She came in here and froze her eggs in her 40s and came back and used them a couple of years later, and she did incredibly well and has a beautiful baby who just
exactly. I'm like, well, she made it. I mean, obviously she had a scary pregnancy, but at the same time, her baby's healthy and beautiful, and like it's great.
Absolutely. But for the average patient, you need to do a consultation with a fertility specialist to see where you stand. The other thing is that we do have women in their later 30s that do really well and are able to make a lot of eggs, but we do know that the quality of those eggs are not going to be as good as the eggs of a younger woman. Yep.
So just so someone knows, basically you freeze your eggs and then you don't know if they're good until you try to make an embryo. So if you're freezing, let's say it's you and your partner are married, or you're going to be together, he can give a sperm sample, you can get your eggs. Once you make the embryo, you're like, okay, these eggs are good or bad. But if you aren't doing that and you're just doing it yourself, you don't necessarily know which eggs are good. So it's good to do it earlier, as like the way I see it, like if you're like, I know I want to be a mom, like no matter, some women are like that, or just like when you're 5, that and you're not in a relationship at 30, like I would personally invest in that. That's what I care about. But because it's a lot of money, but I would still do a payment plan. I'd look at it like another student loan, whatever. Like it's just something to add on because it matters.
It's the most important insurance you're going to ever get for your life.
Yeah.
And I can't tell you, as a parent, it's to me the most important thing in my life. I love my career more than anything, but nothing is your family and nothing is your kids. nothing for me at least. And I think
people don't get that till you have them. I mean, I've even learned, like, people have said that to me, like, you won't understand.
No, it's so true. I love my nieces and nephews dearly. Nothing in the world is like your own children. And I think it's important to talk to parents to support you, if they have to financially support you, if they have to just mentally and physically. I have people that fly in because people just want to be there with their daughters. What I absolutely love is when a group of girls do this together. So when we've had this happen where like 3 girls, they're all friends, they all came in together.
An egg freeze party?
Together. we do have egg freeze party, but I'm saying they came to their consultation
together.
I
see. That's awesome.
We did it together, and everyone was there every step of the way for each other. I thought that was a brilliant thing. So that's always something that is really,
girls
really
are amazing. Girlfriends are like, there's nothing like good girlfriends. It's just awesome. I want to know, because I saw someone ask about PCOS. So I want to quickly touch on PCOS and or endometriosis. I actually did a video with Thais Aliabadi about almost a year and a half ago on endometriosis, and she was insisting that anyone who has it go on birth control to preserve their fertility. Of course, I got tons of comments of people who are like, doctors just want to put you on drugs and like natural alternatives. And like, when it comes to something, that's why I'm always like big on integrative approaches. I'm not like, you know, all Eastern, all natural. Like she said, you don't know how many people I've come in where they weren't on birth control because they didn't want to be on it and they can't get pregnant, and it's heartbreaking. So what are your thoughts on like birth control to preserve fertility if someone has endometriosis?
So as a fertility specialist, whether you're on birth control and not, I tell patients that even if you're on birth control pills, every month when you do or don't ovulate, about 1,000 to 2,000 eggs die off. So I don't want anyone to be under the misconception that just because they've been on birth control, they're preserving their fertility. Because I have patients that come into my office and say, I've been on birth control since I was 15 years old because my cycles were not normal, and I'm 34 now and I have a very low egg reserve, and she's shocked. Being on birth control in no way preserves your fertility.
What about if you have endometriosis? Now, and I'm not saying use birth control so that you can take all the time in the world. Let's say you're not married, you're not like in a serious relationship, you know you want to have a baby at some point, you have endometriosis. Should you go on birth control? Is that better for you?
Endometriosis is when the lining of the uterus starts to grow outside of the uterus and the pelvis. It is very painful. Every month when you come to get a period, what happens is that it gets inflamed and you get significant pain abdominally. What the birth control does is keeps you from getting a cycle, that cycle of building the lining, shedding the lining, building the lining, shedding the lining, which is so incredibly painful and causes scar tissue, and all the other bad things that can happen from endometriosis can be controlled. So it's not preserving your fertility, but it could be reducing the damage that the endometriosis is doing to your body.
Okay, that
you are still losing. You are still during that time losing your eggs.
Right. That just happens after what age? 20? Like when do we start?
All of the charts and studies have shown that the average woman starts to have a decline in her egg reserve between the age of 27 and 28.
27 and 28. Okay.
Right.
So I mean, geez, ideally you could freeze your eggs at 27 if you is that too young?
If women are doing this in a perfect manner, they're going to be freezing their eggs in their 20s.
In their 20s.
I promise you that down the line in the next 20 years, what we are going to realize that part of going to college is to freeze your eggs. And it's going to be unbelievable.
Everything seems weird at first, and then like years later, you're like, oh, that's actually normal. So like, that makes sense.